Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is June 2nd. As of today, the last of Wisconsin's counties have dropped mask mandates for those who are vaccinated against COVID-19. With the last remnants of the pandemic restrictions lifted, we turn to Here and Now reporter Will Cushman, who is in front of the state capitol building, which is now open to the public and as of this week, back to pre-pandemic hours. And Will, thanks so much for joining us.
Hey, Marissa, thanks.
Is Wisconsin on its way back to a new normal? And have some counties been back to normal for a while and others just kind of heading in that direction more slowly?
Right, yeah, that's a great question. It definitely seems like today, as you said, with Dane County being the last county in the state to rescind, or actually in this case, let expire its mask order and other pandemic restrictions on public gatherings and dining and retail and bar establishments, that we are getting back to some semblance of a new normal. But as you mentioned, this new normal has been kind of in process for a little while. Some friends of ours actually at my previous position at Wiscontex, Malia Jones, she's a UW epidemiologist and one of the creators of the Dear Pandemic website and blog. She recently penned an op-ed for the Capital Times here in Madison, referring to this period as the Pandexit, which she warned us all about a month ago could be kind of messy and might be a little confusing for folks as we get toward this new normal. But yeah, there are certainly parts of the state where pandemic restrictions have been pretty much gone for months. A number of counties pretty immediately rescinded their local mask orders after the CDC outlined its new guidance on masking for vaccinated individuals in May, and even before that, with the expiration, or actually with the statewide mask mandate being overturned by the Wisconsin Supreme Court at the end of March, a number of other counties haven't had any local restrictions in place of that since then.
Can you give us an idea of what positive cases look like around the state? Kind of a snapshot presently, as well as general trends overall.
Sure. The general trend is that new cases and overall hospitalizations and deaths are trending downward. And new cases are trending downward pretty quickly. Just last week, the 7-day average for new cases across the state was over 300. Earlier in May, it was over 600, and not too long ago, it was in the thousands. As of yesterday, the 7-day average for new cases statewide stood at 179. And that's the lowest 7-day average we've seen here in the state since late April of 2020, so April 22nd of 2020. So we're definitely at a stage in the pandemic now with a large and growing number of people being vaccinated. Unfortunately, a fairly large number of people who likely have immunity through prior infection, that we are definitely seeing case rates and hospitalizations and deaths going down, and the hope is that continues. I'll just also mention kind of one caveat to that data is the fact that there's not as much testing going on in the last few weeks as there was throughout much of the spring and all of last year. I just want to point out that University of Wisconsin, which was requiring testing for students and employees on campus, at some points during this spring accounted for 10% of all tests going on in the state. With school out of session now, that's a lot of tests that aren't happening. And then it also seems like generally people are just seeking tests a little less often than they were earlier this spring or last year.
That is very interesting. So when we're looking at different counties across the state, we know that not all counties are showing positive cases in the same levels, in the same trends. Can you tell us a little bit about how counties vary in positive cases right now?
Sure. Positive cases are trending downward in most areas of the state. That would include the state's biggest cities, Milwaukee and the whole metro area, Madison and Dane County. I should point out that Milwaukee's mask mandate expired just yesterday. And a lot of other kind of urban centers in the state, cases are definitely trending downward, as they are in actually a number of rural parts of the state as well. There are some parts of the state that have definitely seen more cases, at least on a per capita basis, so adjusted for their population, over the last 2 weeks and last month than they had been previously. Those are generally in kind of the northwestern part of the state. So it started out with some border counties along the Minnesota border, which definitely saw a bit more of a variant-driven surge this spring than we did here in Wisconsin, at least statewide. Those cases and that spread started to spill over the border into border counties, kind of north of the Twin Cities metro area all the way up to Superior. And that since kind of has moved eastward a little bit. Right now, the focal point for new infections is in Rusk County, which is a small county of about 15,000 people, a little bit north and east of Eau Claire.
Very interesting. And so what do vaccinations look like across the state? And have we reached kind of a plateau of people who want to get vaccinated at this point have been vaccinated?
That's a great question. Vaccinations are still continuing to increase across the state. There are definitely thousands of people every day who are still getting doses of vaccine, whether it's their first dose or the dose that would complete their series if they're getting the vaccines manufactured by Pfizer or Moderna. But the pace of new vaccinations is definitely slowing down. It has been slowing down since about the second week of April, not long after pretty much universal eligibility for adults in the state. But rates are also varying quite a bit around the state at the local level. There are some counties, for instance, here in Dane County, fully 2/3 of residents have received at least one dose of vaccine right now, and Dane County leads the state in that metric. Door County, kind of tourist hotspot, a little bit smaller, more rural, is actually leading the state in the percentage of people who have completed their vaccine series. That's in the upper 50%, around 58%. And Door County, as well as Bayfield County, have also seen more than 60% of their local residents get at least a first dose. There's about 12 or 14 other counties in the state that are seeing their vaccination rates, at least for first doses, above 50%. A number of these are kind of suburban counties around Madison and Milwaukee, along with La Crosse County, and then a number of rural counties up along the Lake Superior shoreline.
Do we know if there is a correlation between counties that have lower rates of vaccination but higher rates of cases per capita, and vice versa, higher rates of vaccination and much lower rates of positive case infections?
Sure, that's a really interesting and really complicated question. And I guess my answer for you is that no, we don't really know for sure, at least I don't, based on the reporting I've done and the reporting that I've read, know if there's truly a correlation between vaccination rates right now and the kind of number of new cases. What I can tell you is that areas of the state with high vaccination rates are definitely not seeing cases rise, or at least there's a couple kind of smaller counties, Bayfield and Ashland County, up on the Lake Superior shoreline with higher vaccination rates that have seen a bit of an uptick in cases in recent weeks, but nothing like earlier in the pandemic. And then a number of other really highly vaccinated areas have definitely seen that trend continue to go downward. I guess I can point out that Rusk County and some kind of neighboring counties up there, Sawyer County, Burnett County, have some of the lower vaccination rates in the state right now, around 30%, between 30 and 40% or so. And cases have been kind of elevated around there. I should also point out, though, that the two counties with the lowest vaccination rates in the state right now, Taylor and Clark counties, which are actually just to the south of Rusk County, two also quite rural counties. Clark County also is home to a lot of Amish people and Mennonites, Plain people, who generally refuse vaccination for really any disease, including COVID. Those counties have vaccinations rates right now around 25% or so, and they haven't seen an uptick in recent cases, at least as of right now. I'll definitely be watching that closely in the coming weeks.
And you touched on this a little bit, but do we know of the people who are not yet vaccinated? Why are they not yet vaccinated? Is it folks who are just saying, I am never going to get vaccinated, people who are just still waiting for more information, or are there still issues of access, potentially just not being able to travel to get the vaccine, not being able to get it when they're not working?
Right. Yeah, as I just mentioned, yeah, there definitely are some people who object to vaccination on religious grounds, but we certainly have been hearing about, and I've read through polling data that suggests that there's definitely a political dimension to someone's, or people generally, their willingness to be vaccinated for COVID-19 specifically. We see lower rates of self-identified Republicans express willingness or enthusiasm to be vaccinated for COVID-19 than we do political independents or self-identified Democrats. But there definitely are other elements as well. We're seeing in Wisconsin, which is really a nationwide phenomenon, that rural counties are generally speaking lagging more urban counties in vaccination rates. I mentioned that Door County and Bayfield County have really high vaccination rates, so clearly there are some local areas that kind of buck trends. But when we look at the data overall, rural counties are generally lagging behind. Then part of that may have to do with politics. The rural parts of the state are generally a little bit more conservative, a little bit more Republican than the urban centers, for sure. And there may also be access issues in rural parts of the state. And then also a sort of kind of different understanding of the pandemic and its impact in some parts of the state where that are sparsely populated. There may not have been as much of an obvious impact of the pandemic, either through pandemic-related restrictions on gatherings or masking, or just knowing people who got the disease. So there may very well be just kind of less motivation in some parts of the state for receiving vaccinations. And then I should also definitely mention that we are continuing to see disparities by race and ethnicity around the state in vaccination rates. Even in Dane County, which has the highest vaccination rate overall, there's a wide disparity between the county's white residents and Black and Hispanic residents. The vaccination rate for Black residents of Dane County is standing at about 25% right now. So there's any number of reasons why people may be hesitant to receive a vaccine. As you mentioned, some people maybe just want to kind of wait it out a little bit longer and see how it goes for their friends and neighbors who have been vaccinated. And then there's definitely other people who maybe are open to being vaccinated, but they just aren't as enthusiastic or as motivated to seek out a shot as a lot of other people have been this spring. And they may very well end up be vaccinated when they go for their annual physical at the doctor's office or at another setting, or if their workplace offers vaccination. So we'll definitely continue to see vaccination rates rise over the coming months, but it'll most certainly be slower than it has been this spring.
Lots of factors to consider, and Wisconsin surely ticks a lot of boxes when it comes to geography, demographics, politics, so definitely something to keep an eye on. When it comes to vaccination and masks combined, technically the CDC guidance is for people who have been vaccinated, don't need to continue wearing masks, but what's to stop someone who has not been vaccinated from not wearing a mask?
That's a really good question, and I think one that a lot of people, based on my social media feeds, have been asking lately. And I guess maybe a small sense of shame potentially would encourage some folks who haven't been vaccinated to continue wearing masks in public spaces where the CDC says they should be doing so. But we also know that there are definitely people who are kind of skeptical of sort of public health interventions related to COVID generally, whether they be masks or vaccination. So the kind of logical conclusion of that is that there may very well be a number of unvaccinated people who are deciding to put their masks away along with everyone who's vaccinated right now. And you're right, you can't tell unless someone tells you what their vaccination status is. So I think the way I've kind of internalized myself personally, the CDC guidance, is that I'm sure that the scientists of the CDC have considered that the potential for unvaccinated folks to lose their masks now that masks are no longer recommended for vaccinated people. And really, I think they're signaling that vaccinated folks should put their trust in the efficacy of these vaccines to protect them from infection should they be exposed to the virus at this point.
Now, from the top down, the federal level to the state level, it has been reiterated that the government is not going to require anyone to get a COVID-19 vaccine. However, the Wisconsin Republican-controlled legislature is working on legislation that would ban an employer from requiring a COVID-19 vaccine, which is legal. And would also ban businesses from discriminating against people who have not been vaccinated. Are those real concerns that are playing out in Wisconsin at all, or is this legislation not really going to have much of an impact?
You know, that's a really good question, and you're right that bill, from my understanding, is still kind of working its way through the Capitol building. But as you mentioned, the EEOC said that employers can, in fact, mandate vaccination for employees, with a couple important exceptions, those being medical reasons, and also if an employee holds a sincerely held religious belief and practice that is sort of, I guess, against vaccinations in general. Then those would be a couple exceptions. You know, we haven't heard, at least in Wisconsin, of many employers intending to require vaccination at this point, or places of business intending to require that patrons be vaccinated. Anecdotally, I've heard of a couple small establishments that are asking about people's vaccination status, just quite local places. And then we do know that there's a couple colleges in the state, private colleges, that are going to require students and faculty and staff to be vaccinated with the new school year. From what it sounds like, that will not include UW's system campuses at this point. But from my understanding, reporting on this lately, it doesn't seem to be that employers don't seem to be jumping at the chance to mandate vaccinations, whether it's of their employees or the patrons of their businesses.
It kind of seems like a patchwork of kind of different requirements, different places. But in a lot of cases, there aren't really a lot of requirements. This seems kind of confusing both for people who have been vaccinated trying to navigate their safety, as well as people who aren't vaccinated trying to navigate access or requirement issues potentially.
For sure, yeah. Back to the Pandexit and kind of the messiness of the current stage in the pandemic that we're in. Certainly, it's a messiness that I think pretty much everyone would gladly take over where we were at last fall, with a number of hospitals in the state being at capacity and record numbers of new cases and deaths, but it's still kind of messy and confusing. I know that a number of kind of big box stores have said, kind of national chains, whether it's a place like Target or Walmart, or large grocery store chains, have said that they're basically leaving any like masking or whatnot up to the discretion of their patrons, and hoping that people are being honest about their vaccination status when they forego masks, or adhering to local ordinances and orders, which big box stores and other establishments here in Dane County and also in Milwaukee were doing just until yesterday or today. But as of now, no one is really required to wear a mask in most settings. That doesn't include kind of public transportation, plane rides. There are definitely still some offices that are requiring masks for some time. I know that the Dane County government offices are going to be requiring employees and visitors who are on site to continue masking through early July, and they say that's to give employees a little bit more time to get a vaccine. But yeah, we're definitely at this stage where I think the best piece of advice that I can give, one that I'm following myself, is just carry your mask with you. It never hurts to have one and be prepared.
Absolutely. And of course, it doesn't hurt if someone who is vaccinated still wants to wear their mask. They absolutely can. Thank you so much, Will, for all of these updates. We really appreciate it.
Of course. Thanks so much, Marissa.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.